All right. Welcome, everyone, once again to another episode of Sleep Tech Talk, the sleep podcast, with your hosts and friends, Emerson, Kerr, Robert Miller, and me, Dr. Gerald George Mannikarote. Folks, once again, it's another year, another episode, another day, and we've got an interesting one for you. But before we get started, we want to tell you thank you so much for all that you've done for us, helping us to be the most popular podcast in sleep technology, if not the only podcast in sleep technology. But that's not the point here. Thank you
The only
so
one
much
that
for your
matters,
support.
Terry. It's the
That's
only one that
right. Yeah.
Exactly. But thank you all so much for your support. We just continue to grow and we can't thank you enough. We're past 30,000 subscribers and it's all because of you. A huge shout out to our sponsors for helping us with this endeavor and helping us grow. We can't thank you enough for that. So, folks out there, please be sure to support the sponsors as well. With that being said, it's a different episode today. We're not doing the usual, and it's just the Three Stooges here for you. We're going to be talking about what we learned and what has happened in 2024. And I'm going to toss it off to both Robert and Emerson to get us started. So, gents, what have we seen so far?
Now a word from our sponsor, Medbridge Healthcare. Medbridge Healthcare is a leading provider of sleep lab management services and home sleep apnea testing. Medbridge partners with hospitals, healthcare systems, and medical academic institutions to offer comprehensive, fully integrated services for sleep disorders.
Emerson's older than me, so age
Oh,
before.
nice.
Age
Yeah.
before beauty.
Yeah.
Well, I think we really had some fantastic guests this year, and some of the ones particularly with unique practices, and I think I'll take a moment to talk about that. As with Dr. Singh and Fatima Deni with iSleep, Allison Cole and what she's doing in New Jersey, and her podcast of really focusing on educating her patients. Funke Aflobi Brown, Dr. Brown, she is doing amazing work with not just pediatrics, but pediatrics in the family. So I think as we look at these different positions, Dr. Rama, who we saw right at the end of 2024, they all are doing something unique in what they do in their sleep practice. And I really find that fascinating because, that's a common theme with Sleep Tech Talk, are these entrepreneurial mindsets. And these physicians, including Dr. Chopra with Empower Sleep, are really doing something unique. And that is looking at their market, looking at really just patient need. I mean, when you think about the fact that 85% of the sleep apnea patients are still undiagnosed and untreated, we're really able to tap into some unique physician models that are trying to really overcome that burden. And I feel like these doctors we've had on this year have done a great job of trying to do that through their unique business models and their practice models. So shout out to these guys. I've really enjoyed seeing them this year and hearing their unique take on how to do sleep medicine through their practices.
No, I agree. And this is it feels like we're in a year of transition to me. And what I mean by that is, there seems to be a shift in diagnosis of patients and how patients are diagnosed, and sort of an expansion of that category. Although I would say that there's also some barriers there as well, where you've got some of this new technology that's out there. Some has received some adoption, some of the technology not so much. And and at the same time, reimbursement models work in some cases, and in other cases they don't. And in some cases, we need them to work in order to be more comprehensive in how we treat or how we diagnose patients. But it seems like the reimbursement is just not quite where it needs to be yet, to sort of mirror where what the diagnosis pathways look like. And then from a treatment standpoint, and we've talked a little bit about this with some of the folks who are out there, about CPAP, and Dr. Noah. We've had him on the show a long time ago, but now we're starting to see toward the end of 2024 that 2025 will be the actual launch of CPAP therapy. But there's other companies out there that are developing other types of PAP algorithms. So I think even CPAP is going to change. So I'm excited about the transition. You know, I think it's there's some things that are a little bit of a slippery slope because we don't want sleep to, you know, roll into a black box and no one knows what the technology is and what gets, you know, what the results are on the other side of it. But you know, even with our one of our conversations recently with the medical director of the ASM, you know, we talked about personalization of sleep care. And, you know, that's what I hope that this technology will help us do is to find the right diagnosis pathway for a patient and then the right therapy for a patient, no matter what the sleep disorder is. And that it's, you know, it's a therapy and a treatment that the patient is going to use and be adherent to long term. I'll stop there. I could talk for a while.
Well, Robert, I would love to continue hearing you speak, but I want to just tease out one of the points that you just brought up, which was that 2024 was a year of transition. We got to see so much in terms of the direction sleep is headed. You know, for decades, the only therapy that you had for obstructive sleep apnea was just just CPAP, right? Prior to that, it was all the other crazy things, tracheostomy and that sort of thing. But now then it became CPAP or bilevel, and that was the end of it. And now to say that there's a different way to deliver this air pressure into the patient's body is just absolutely phenomenal, to even mind blowing to think about it. And on top of that, when we had Dr. White, he told us some of the things that he sees in the horizon, such as the medications. And then now our AASM president talked about that as well, that there's going to be so many different changes coming on. I think that's the biggest thing I see in terms of products and technology for 2024, is that 2024 was the year of transition, showing that, like you said, Robert, it's not going to go into this black box, hopefully, but it's more of, hey, where can we push the limits of technology? Where can we push the limits of treatment options for a patient?
I think the beautiful part of that is like when you take the Vortex PAP and the KPAP, you've got two completely different models of delivering support for the airway to do that pneumatic splint, and they're completely different than what we've done since 1985. And there's some beauty in that, but it's also kind of unmask a problem, is that sometimes we have our confirmation bias about everything. We believe we can't run any faster, do a 100-yard dash any faster than we've ever been able to do it, and then suddenly somebody breaks that record. And I think now that we've seen the Vortex PAP and the KPAP, and we're seeing these different pharyngeal stimulators, I think we're going to see more and more breakout. I mean, just with the GLP drugs, we had the episode months ago where we talked about that. I think we're going to learn more about, what those actions of those drugs are on the airway. And I think that all of this leads us to like what we're talking about is unique ways of being able to care for the patient like we've never been able to do before. So it's a beautiful season, but I think you're right, Robert. It's been a year of transition. 2025 is going to be exciting as we see a lot of these things begin to really take shape over the next year.
But especially toward the end of the year, you started to see, consumer devices start to upgrade their technology to the point that now they're getting FDA approval and then partnering with Insodata to, add some of the PPG. And it is my one warning for sleep techs, and I don't mean this in a completely derogatory way, but I want to make sure, and it's why I, have spent time going around to regional meetings talking about updates in sleep medicine, because I want our sleep technology colleagues to understand these new technologies and how they work specifically, just like they understand the nuances of what makes up a full polysomnography and the channels, how they're derived and the frequencies. I want them to understand all of the specifics of PPG and PAT and so that they understand what role it plays and where it can best be utilized in certain patient populations, but where it may not necessarily be appropriate in others. And in some cases, they may need to even educate the physicians that they work with relative to some of these new technologies.
So, Robert, you bring up some really, really good points. So I'm going to it's a great segue to throw this off to Emerson. As AAST president, where do you see it going for sleep technologists? What do you see for sleep technologists in general? Because that's a big question out there right now.
I think the great thing is there's still 84 sleep disorders. And, but the challenge is that so much of what we do in sleep medicine and technology is focused on one. And I think, as we heard from Dr. Olson in our ASM episode, the need for the attended test is really going to focus more on the complex patient and owning that. And I think for our technologist colleagues, we've got to step in there and really own that journey. I think AI and owning AI is a key part of that. Trying to stand against it, is not going to be the successful outcome that somebody thinks it's going to be, because the technology is there. It's getting better every day. The key is where is it taking us? Because if we can learn about endotypes, phenotypes, and really change how we do our patient care, then all of these new technologies, all these innovations become even more applicable. Whether it's a pharmaceutical solution, a stimulator, a different kind of PAP, whatever it is, this new way of being able to diagnose and really drill down into the patient is exciting. And I think it really is kind of fun, because if you think about it, as we're able to see more of what the patient is through this AI endotyping insight, there's all this new technology too. So then the question is sort of, it's the genie thing. What can we wish for? And how do we now direct that patient to the right care? And I think sleep techs really should be there. We've all talked about the role of CCSH and sleep educators, sleep coaching, and I think that's all part of that. It's really, I think if we really look at what the technologist opportunity is, it's owning the patient care journey and really being that advocate for the patient, so that as we learn what that diagnosis is, all those types and subtypes, are we the ones that can better direct the physician and the patient to the right care and the right therapy, and really hold that patient's hand through the journey? So when I look at the future, I think it's really the technologist stepping into a new role of owning that patient, owning their journey, and helping them succeed in the full spectrum of what sleep medicine and sleep technology is.
Are you a sleep tech looking for new opportunities? Well, Medbridge Healthcare is one of the largest employers of sleep technologists, and they are growing. If you are a sleep technologist interested in a new position, potential paid relocation, or looking for a career advancement, consider a career with Medbridge Healthcare. Now back to the
You
show.
You
know,
know, it's interesting, and this is a terrible example, Emerson, but I stopped at Bojangles yesterday, and
Get you some fried chicken.
well, it was I was getting a Cajun filet biscuit, and it was AI that took my order at the drive-through.
Oh
But guess
wow,
what? AI could not hand my food out the window to me in my car. So
that's right.
it was still a human being who made physical contact with me in order to deliver the service. So it's a crazy example, but it's exactly, I think, what sleep techs have to take into, I think it's the way they have to take into account some of these new technologies. Because it became a tool, and
Yeah.
essentially made the person who handed me the food more efficient, because she wasn't, waiting to take the next order. She was already filling the orders, and then all she had to do was to provide the therapy, if you would, if it's a sleep tech. So,
Well, I'm going
um,
to keep saying it. People take care of people, and
yes,
it
right.
doesn't matter if it's a chicken biscuit
yeah,
or a CPAP. At the end of the day, the empathy, the interaction. I mean, I was in Hawaii last week. A robot brought our plate out to the table, but they couldn't have a conversation with us about how satisfied we were with our experience. And the waitress even said that, which was hilarious. But we are the people as sleep techs. We are the hands-on aspect of care, and we can't lose sight of that.
Well, I still go back to also that, every time I've talked about proactive sleep apnea screening programs within any healthcare system, the overwhelming response always is that we don't have the resources to to diagnose and to treat the number of patients that would be identified in a sleep screening program. So if we know that that's the barrier, then we need more tools and more resources to diagnose and to treat patients. Last time I checked, most sleep labs are booked out still, and I know that all of the big home sleep testing companies are doing more and more tests all the time. So we are getting more patients through the funnel, but we talked about this earlier in a different conversation that there is a disconnect between diagnosis and getting patients on
And treatment, right?
on treatment today. So we've got to figure out is there an AI tool that keeps the patient engaged, or has the technology become so simplified that it sort of demeans the potential issue that sleep apnea could be for that particular patient, and it doesn't seem so scary, having sleep apnea when I can wear a ring and I'm diagnosed, or that I wake up and my Apple Watch tells me I have sleep apnea, versus going into a lab and this is a big deal. It's a big procedure. I have to stay all night. I went to the hospital. That made it a little bit more serious, I think. So education, 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 I think has to become part of what we do for patients to help them move from getting diagnosed to treatment.
Robert, you just said something which, kind of ties in what Emerson said earlier, which was about the sleep navigators and, the navigation piece. I know that wasn't really our focus this year, but would you consider that as part of the transition that you're seeing more and more of these in
No, I
hospitals
think that,
across the
yeah,
country?
unfortunately, I think the adoption is still slow. But I feel like it's absolutely a part of the evolution of what's going to happen for sleep technologists. If reimbursement ever allowed for full polysomnography to be done in the home, then that would open up some opportunity, I think, for sleep techs to spend that time at the patient's bedside, knowing that we're going to discharge you to the home, but we're going to get every bit of information that we would typically get if we made you wait for 6 weeks to get into the sleep center. So you push the diagnosis, closer to the point of discharge. Again, education, education, education. And every time I talk about sleep screening programs, I always tie the patient's, admitting disease state or admitting issue to sleep apnea, so that they sort of it's disease specific, I guess, or condition specific sleep apnea education. Sorry, I feel like I'm taken away from our 2024 conversation. So and
No, you're not. You're
I'm
not. I
always
think
super
education is a
passionate
huge
about this
piece,
topic.
man.
So sorry about that.
No, no, I think education is a huge piece. In fact, I think that's a big, big part of 2024 is the fact that there's more awareness now of sleep and sleep disorders in general. More and more, like if you turn on the TV, for example, people are talking about the importance of sleep, as opposed to what it used to be is, sleep when I'm dead kind of thing. And
Yeah.
and you've seen a whole lot more of that in 2024. People, in fact, I had somebody on social media, a yoga person, reaching out to me asking me about mouth tape and why they do all the alternative stuff, those folks. And
Yeah,
but they
don't
were
do it.
asking me, well, I mean, it's more than the don't do it. It was the fact that somebody was seriously consider asking about something like this, and obviously I said you don't don't do that. Go
Yeah.
and check it with your doctor. By the way, somebody was telling me about this the other day. Yeah, this whole mouth tape thing, you've started hearing less and less about it now. It's just kind of went out the off the wayside. But the point is not that. The point is that there's a bigger discussion, and we have seen in 2024 about sleep in general. And I think that's a lot to do with the education. And I think with more education, you're going to see more discussions, and not just more discussions, but more awareness on what you need to do in order to get good sleep. Like you spoke about the ring. There's so many devices. 2024, 2023 into 2024 is when the smartwatches started becoming a thing about diagnosing, or not diagnosing, detecting sleep apnea, for example. And you had more and more people talking about it. In fact, my kids, they brought that up. They sent me a message, Dad. Hey, this just came out, and I was like, yes, thanks, son. I knew about it. I happen to be in the industry, so
Emerson, you got quiet on us. You okay over there?
No, man, I'm enjoying you guys. I think, but I think personalized care is really what we're talking about. At the end of this is that, you look at what Apple's doing, with ResMed. You look at what, all of these different things leads us to what patients are asking for. They want a solution that fits in their life. The challenge is with everything, if there's not ownership by the patient, then it has no value. Nothing that's free has value. So what is it that they own in the journey that makes them feel invested? And I think, what we're seeing is that, I mean, if you spend a lot for an Apple Watch, I mean, my mom is an example. It told her she had AFib. She went to her cardiologist. He confirmed she had AFib. And I think more of that as patients are alerted to what's happening to them, that their oxygen level dropped during the night, that's going to frighten them. And I think it creates that needed ownership. So for them to step in and seek that. But, whether it's, obviously mouth tape is the beginning of a journey that we hope ends in legitimate therapy. But I think the question then becomes is where do these new medications go? Because as we think of endotyping, and I'm absolutely fascinated with that, is where does it begin to lead us toward, where these medications are taking us? I mean, I just heard a talk just the other day on Mounjaro. I mean, it affects two different hormones in the body than Ozempic does. And the question I asked the physician that was speaking is, what do we know about its effect on sleep disordered breathing, specifically the airway? And he said, we don't know, but we're asking that question. So I think, where we're heading in our future is as we look at these medications across the spectrum, what endotyping is telling us is how medications can either supplement or be the answer to therapy, depending on what's going on with that patient. And I think that's exciting, but it brings it back to that personalized care that we're talking about across this whole spectrum.
And I think that the world of, the world of all of these new consumer slash clinical grade technologies that have entered our world, I know that we all want to talk about remote patient monitoring, which I think is absolutely critical. The problem is no one seems to have figured out how to monetize it in a way that really makes it, sustainable for the long term. And I almost would rather us get focused on long-term monitoring, because if we do have something that's super small and we essentially get a mini sleep study every night from that patient, it gives us some insight into some things for the long term. Increased respiratory rate for a COPD patient may mean an upcoming exacerbation. Well, if we're monitoring that on a regular basis from and then using software to be able to identify high-risk patient populations so that providers can absolutely focus in on those folks who are vulnerable. And to me, that is how we help to keep them healthier, number one, but then secondly, lower cost of care for those patients. And it's it's pretty simple technology now. It's just there's no reimbursement really that makes it make sense. And I don't want us to miss one more topic before we lose this the time here on the episode. And I know we've talked about sleep apnea a lot, but insomnia is another. And I think our guest and people who viewed our YouTube channel spend a lot of time, especially on the episodes that deal with insomnia. And as an industry, that we talk about it. There are some solutions that are out there. We've had guests and new technologies on our podcast, but that's one for me where it's like, it's we don't have great solutions. Where there's the gold standard of CPAP for sleep apnea, we don't have the gold standard of
gold standard, right?
Treatment for insomnia. So to me, that's something that maybe as we go for us, Sleep Tech Talk goes into 2025. We really try to dig into that piece and make it a big part of what Sleep Tech Talk is in 2025 to help advocate for that particular disease.
That's a great point, Robert, because there's OSA is not the only sleep disorder, and Emerson loves to talk about that. And in fact, that's what he said just
Me
now.
too. It's what I do for a living, man.
Yeah, exactly. So there's a lot more to it, but yeah, that's definitely something to think about. Is is these pieces. Emerson, you were going to say something. I'm sorry.
Yeah, I totally agree. It's tough because, like I mentioned earlier, there's 84 disorders, and it's easy to lose them. But some people are going to have multiple of what those classifications are. I think another thing, as we think in that space, and it's one of the talks for the sleep tech track at the sleep meeting in Seattle that I'm excited about, is one of the guests is going to be talking about heart rate variability and suicide among veterans. And so, as we look at these parameters that we can pull out of a sleep study, it's far more than AHI. It's far more than what we think about. There's so many other pieces that we're learning from these metrics that really tell us more about the patient. So when we think about insomnia, what will we begin to learn as we understand from whether it's a watch or a ring or whatever it is, a PPG or pad or even a full type 3 device, what do we begin to learn about that patient that does tell us why they're having insomnia? I think that's part of our future is, what do these novel parameters begin to show us and give us insights into the patient? So that, again, takes us back to personalized care. But I think that's an exciting part of the future. And I think we'll see some of that really begin to surface here in 2025.
So that kind of leads us to it. We're getting on for time, but a great way to close is, what else do you guys see in 2025? What does it hold for us?
Well, I have one special reminder for our audience. At the sleep meeting in Seattle this year, there 3 of your favorite podcast hosts are all part of the AAST's sleep track at the sleep conference this year. So we need you all there. We want the audience to be packed with sleep techs, and we promise that we'll try to bring some of the newest and freshest content as part of our presentations. And Emerson and I have had an opportunity to see the agenda. It's great. And we need everyone who's in the field of sleep medicine to be at this year's meeting.
Absolutely.
Thanks,
Sorry,
Robert.
that was a little plug for the AAST.
No, I'm glad you did. I'm glad you
We
did.
need it.
All right, I think that's a great way to close. That's one of the things to look forward to in 2025 among all the other things we talked about. And folks out there, thank you all so much once again. We can't do this without you, and we do this for you. Don't forget to check our sponsors. Huge shout out to them. So until next time, we say cheers.
Before we go, we would like to thank our sponsor, Medbridge Healthcare. Medbridge Healthcare is developing innovative inpatient, post-discharge, and population health programs to screen comorbid conditions, diagnose, and treat sleep disorders. Learn more about their innovative solutions and career opportunities at medbridgehealthcare.com. Once again, you can learn more about their innovative solutions and career opportunities at medbridgehealthcare.com.
Sleep Tech Talk is sponsored by ReactHealth. Within our LunaPAP device line, each offering is FDA approved, encompassing CPAP, APAP, bilevel, and bilevel ST models. Our thoughtfully selected array of PAP interfaces and accessories complement our LunaPAP device line while accommodating diverse patient requirements.